We are very pleased that you've joined us this morning for our webinar on accelerating family caregiver friendly healthcare in British Columbia, and we're going to be covering 4 main points this morning. The first is just to underscore the very important role that family caregivers play in our healthcare system. The second is why it's so important for you in your practice to be including and engaging with family caregivers as partners in care. The third is why it's important to support family caregivers as early as possible in their caregiving journey. And the fourth is what we do in British Columbia to support family caregivers across the province. So that just gives you an overview. Our definition of family caregivers is any family or friend caregiver who provides unpaid care to an adult, either at home or in a facility, with a physical, mental condition, or chronic illness and frailty due to aging. The key being unpaid. Caregiving is huge, and the current stats, the best statistics that we have to help quantify the magnitude of caregiving is gathered through our Canadian Stats Canada General Social Survey. It's done every 5 years. The data that we'll be using in this presentation is from 2012. It was updated last year, and that new information will be available in the fall of this year. So any of the numbers that we're providing in this presentation will be an underestimate. We have to emphasize that. It's pretty huge. So how big is caregiving? Well, in the last survey, again, that was done in 2012, 28% of British Columbians are caregivers. So moving quickly towards 1 in 3 people. 89% are caring for more than 1 year. 80 to 90% of that care is in the home. The majority of the caregivers are still women, and 60% are employed. And we'll be coming back to that stat in our presentation. So using those estimates of 1 in almost 3 or 28%, that would mean that there are over 1.3 million caregivers in British Columbia. That's a staggering number when you think about it. This iceberg is one of our favorite pictures just to represent the caregiving journey and what the role of caregivers involves, because what you see on the surface is an underrepresentation of what caregivers do. In this slide, we show that roughly 75% of caregivers help with transportation to and from medical appointments. A third are involved in scheduling, coordinating appointments. And this fourth one was really interesting. This is almost 25% are involved with medical treatment and personal care. And that's a growing percentage of the work that's being done by caregivers. This is an infographic that is another way of looking at the caregiver role. And what it shows is that for every hour of paid professional care, caregivers are providing 10 hours. So roughly 242 million hours of care in the home. And we know in British Columbia from the Seniors Advocate Report that was released in 2017, 97% of clients who have home care in the community have family caregivers. So again, it just is another way of demonstrating how important caregivers are. Caregiving is a win though, so we don't want to represent caregiving as being a burden. We use that term, but really caregivers prefer to provide care to the people that they're caring for. In the 2012 Sinha Report that's based on the General Social Survey stats, 92% of caregivers report the experience as rewarding. 70% talk about how it strengthened their relationship with the person they're caring for. Caregivers, there's no doubt, are the best people to provide support to the care recipient in the environment and surroundings they choose. And no one knows the care recipient better than the caregiver. The downside of caregiving, though, is that it does have implications for caregiver health. And what we know from the stats is that caregivers experience adverse effects of caregiving in terms of chronic health conditions at twice the rate of the general population. So they experience stress, anxiety, depression. We'll be coming back to those in a later slide. As well, caregiving is a financial risk. And again, from the stats, 60% of caregivers are juggling work and caregiving, 43% disruptions to their work, 15% report having to cut back on hours, 14% report losing pay and benefits, and 10% turn down workplace opportunities. So, when you think about 60%, and again, we have to emphasize, we really believe this is an underestimate at this point, of people, caregivers who are caring for a loved one while they're also working. It's really critical to know that can have huge implications for employers and employees in the workforce. Again, just a slide to show the impact of caregiving for our healthcare system. That 242 million hours of unpaid home care is huge. $25 to $26 billion value to the system annually, and that would translate into roughly $3.5 billion of value to the BC healthcare system.
Well, and I think the important part is that individuals who are receiving care, they simply could not live at home or live independently or successfully without those family caregivers supporting them. So even though it's a financial piece, it couldn't happen without those family caregivers taking on that extra responsibility that our healthcare system simply can't financially and resource-wise.
Exactly. That's a very good point. So we talked a little bit about the impact of caregiver stress, and this is for those of you in practice, this just is obvious that if a caregiver gets sick and burns out, then they're no longer able to support the person that they're caring for. Then it has a knock-on impact on our services in terms of, as Wendy just pointed out, we can't support the person to remain in the environment that they would choose. So very often they have to go into facility-based care, they go into acute care, and most important, the care recipient loses out in terms of being able to have that person that knows them best provide the care that they would choose to have. So what are the signs of caregiver distress? We talked about them having chronic conditions at twice the rate of the regular population. Well, first of all, what we know is that they're in denial about the disease and the effects it's having on the person that they're caring for. They experience anger. They're often, forced into situations where they socially isolate because they're so involved in their caregiving role. They have a lot of anxiety about the future, about their ability to juggle all that's on their plate and continue working possibly, or caring for younger family members still. They may have children in the home still. It very often results in depression, exhaustion, sleeplessness, and lots of impact in terms of emotions and being able to just regulate themselves, and lack of concentration on daily activities and also in the workplace. So again, we talked about burden, which leads to burnout, and increased pressure on our healthcare system in terms of things like emergency department visits, days in hospital for admission, and then facility-based care. And as we know, as a system, we are moving more and more towards being able to support people with chronic illnesses, frailty due to aging, physical, mental issues to remain in the community while they do that with the support of family caregivers. So the question that we often ask is, if home is best, who is not home? So our call to action, and the reason that we're doing this webinar today, is to say caregivers need to be supported. So in the rest of the webinar today, we're going to be talking about, the situations where you may encounter caregivers in your practice, what you can do to acknowledge, identify caregivers, and finally, what we can do to support you to support caregivers. So at this point, I'm going to turn it over to Wendy. Thank you.
I think just an important piece that's really important for us to highlight is that we're not asking healthcare professionals to physically provide the support to family caregivers. In fact, that's our role as a provincial organization or other community-based resources. Our biggest challenge is that family caregivers simply don't know where to go or where to find access. And as healthcare professionals, to be able to identify them and refer to us would be of such benefit to yourself as healthcare professionals, because what we hear is that often professionals often feel at a loss, or they feel that they're not able to help a family caregiver who is in distress. And so by referring into our organization, we can actually pick up that baton and run with it and provide the support to caregivers across the province. So the caregiver support piece is actually critical, and there is increased evidence that family caregivers who are supported early in their journey have a much better chance of sustaining their role. And we're going to talk a bit about something that's a bit of a double-edged sword, because family caregivers also don't self-identify, and so often it's a bit of a process for them simply to accept their role as caregivers or identify as a family caregiver. There's been quite a bit of evidence around family caregivers and supporting them, and one of them is the Cares Express since 2008. And what they've done, they really targeted physician practices, because we know that that's often where everything sort of focuses around visits to the family physician. And so what they're looking at is this multi-pronged approach that was used to create awareness to make it really easy for physicians to identify and refer family caregivers. And so here in the province, we call it the 10-second handoff, where caregivers are identified and then providing an actual referral to an organization to say, this organization can support you, in your role as a family caregiver. And interestingly enough, in Britain or UK, it's an actual care act where healthcare providers must identify caregivers and offer an assessment. So what we're seeing in different parts of the world is that it's actually embedded in the healthcare system. So family caregivers are embedded in the process of referral, so that they're supported along with the individuals that's requiring support. So in terms of, we recently come across some information from Scotland, and so they had this Caregiver Scotland Act, which was just recently back in 2008 April, and it's an actual right for family caregivers are set out in a charter. And there's an actual support plan that's customized for each caregiver, which includes the extent in which the caregiver is able and willing to provide. There's actual outcomes that will help caregivers ensure that they're able to support themselves while caring for someone else, so that their own health and well-being doesn't decline as a result of the caregiving role. Because that's often what we are, we're seeing, especially as disease progress, when we're looking at individuals with either mental health challenges or dementia, that the extent of the care starts to take a real toll as the years progress and as the disease progresses. And working with that family caregiver to identify what supports are available, including respite, which we know in British Columbia is a huge area of concern for family caregivers. And then also to help identify what supports will actually be provided for them in their role as a caregiver. And then having that ongoing follow-up, and that's a really critical piece, is the follow-up. So once we support a family caregiver, it doesn't mean that we think, great, now you've got your plan, we can go ahead. It's actually critical then to come back and say, so how are things going now? Have things changed? And to continue supporting that family caregiver to reach out to the supports in which they currently have. So in Scotland too, the caregivers actually have a right to be involved in the care plan and in determining how they can support the person that they're caring for. And they're actually considered alongside of the person receiving the care. They're actually looking at how do caregivers assess their own needs for support and how they are able to provide that support. And the local authorities they have to consider where the family caregiver is at in terms of the person being cared for and their abilities to be able to continue providing care where they need more support, and what's the best interest for both the caregiver and the care recipient. And that's a bit of a shift where we're currently at in our province. And this whole idea that family caregivers require respite, they require a short break in order to come back and recharge the batteries, or feeling recharged, having respite away from their caregivers. situation. And then just with hospitals, one of the key pieces is that caregivers have to be involved in the discharge planning process. So I think, to sort of summarize the piece that we're learning from the UK and some other countries is that family caregiving, in terms of supporting caregivers, is embedded in their system, and it's something that we hope to work towards here in Canada. So in terms of the Canadian evidence, what we have found is that there's a program out of Ontario called the Caregiver Recharge Program, and it consists of both health system and community-based services. And they did an actual study where they had a control group of caregivers who were enrolled in the Recharge program. And what they found was that the rates of long-term care admission were lower, and the length of time to long-term care admissions were longer. And so from a health savings perspective, what we're seeing is that we can actually reduce or avoid long-term care admissions as well as delayed admissions. And so you look at sort of the annual, in that particular study, the annual net savings, the estimated, at $850,000, which is huge for the number of avoided long-term care admissions of 13%, a very small amount of long-term care placements when we think of what's happening across the nation. So what are some of the issues in supporting family caregivers? We talked about this briefly. Family caregivers don't self-identify. Often, it's really quite a fascinating, they don't often see themselves as family caregivers. It's just part of their role. It's part of what they do as a spouse or as an adult child or as a sibling. And so often they don't really see themselves that they are a family caregiver. The focus tends to be naturally on the care recipient, the patient and the client, because they're the ones that are experiencing medical issues. And so part of it is to actually shifting our culture to help identify and support and include family caregivers in the process. They're often there right with the care recipient. It's just that the focus tends to be on the medical issues. What we also know is that family caregivers often indicate that they're doing fine. And so asking them once, you'll typically get a response that, no, I'm doing fine. It's often as things progress that things tend to worsen. And so continually asking how that person's doing is actually a really important piece. We also know that one size doesn't fit all. Family caregivers require different types of support, and the research shows that sort of the multi-intervention strategies are the best way to support family caregivers. And so we talked a bit about this as, this idea that we're fine, but family caregivers slowly start approaching this cliff and then they go over. And so those are some of the challenges in being able to support family caregivers.
And I think what we find in our own service statistics is that, by the time the caregiver reaches out to us, they've usually been caring for about 4 years. And, in some work that was recently done in Ontario, the survey showed them that 35% of caregivers don't understand that they're caregivers until the role is explained to them. Right. They don't get it. They don't see, as Wendy said, they don't see themselves as caregivers until someone says, well, actually, you are caregiving. That's a role that you've taken on in addition to your relationship with the person that you're caring for. So it is really significant.
And I think also one of the things that we, find in the work that we're doing supporting family caregivers is that as human beings, we're really incredibly adaptable. And so often what happens is we, family caregivers start to adapt to this new normal, but it doesn't mean that new normal is healthy. They take on more responsibilities, more care, and they adapt, but they're not necessarily towards a better health. But they don't often see that because they just simply adapted or changed to fit the current circumstances. So this idea of shifting to caregiver-friendly healthcare, we like this slide because it demonstrates what we're trying to achieve in this shift culturally, but also how we can support family caregivers across the province. So family caregivers often talk about feeling invisible. They're unsure about their role or how they can help or how they can provide care. and they often feel excluded in the care plan process. I have this example of my mom, when my dad had a massive stroke, and she she was working full time, and she was organizing her work schedule to take my dad to see the neurologist and to see all sorts of specialists and to look at discharge planning. But everything, my mom said she just felt like she didn't often exist in the room, that everything was about my dad and how are we going to get him back home, how are we going to support him. And not once at that point in time did they ask about my mom and whether or not she was able to actually do any of that. Now, mind you, that's a decade ago, and we have come forward, but we still have a ways to go. So when we're looking at shifting to caregiver-friendly healthcare, we're looking to identify and recognize family caregivers. We're looking to refer and support them and to engage and include them. And that really, I think, summarizes nicely also what Family Caregivers of British Columbia can do. We're going to talk a bit about that a little bit later. So how do you identify family caregivers? And so often, if people don't self-identify, we have to help them self-identify. And so often it's around having healthcare professionals, for example, instead of saying, are you a family caregiver, use a different language like, are you looking after someone who couldn't manage without your help? Or are you helping someone with transportation? Or are you helping them with grocery shopping? You can ask the actual patients or clients if there's someone who takes them to doctor's appointments or helps with their care. And so it's this idea of trying to embed identification of family caregivers into care processes. So if your medical clinic is looking at their intake process, well, could you have a question there in terms of identifying a family caregiver? That's one of the ways.
And certainly the benefits of including a caregiver for you as professionals and healthcare providers, it's going to be pretty obvious. But there's no one that knows that care recipient better than the care provider. So they're going to be able to provide additional evidence about the plan of care. They're going to be able to discuss with you the best way of developing the plan so that it can be easily implemented. They can prevent med errors once they're at home with the care recipient. They can be double checking meds, and there's just all kinds of ways that they really make sure that the return home or the support in the home is successful.
And I think we also know too that one of the challenges with healthcare professionals is that we only see individuals for a very short period of time. And so a family caregiver can also bring in that history, the context, if certain challenges are reoccurring, so that they can really round out the current situation at home or in facility or where that individual is currently living. And I suppose the really important piece too is that we actually can't help. We can't, and none of us can help family caregivers unless we identify them, unless we start asking the questions and including them in the care process. So once a caregiver does reach out, there are many ways that they can be supported. And really, if there's one thing that we take away from this presentation and the support process, referring them into Family Caregivers of BC, for example, is one of the best ways to help provide them with support. But we do need the help of healthcare professionals to help them take that first step as well. So what can we all do? We talk about identification, which we've discussed, refer and support, include and engage. Those are our three main areas that we're working towards. And often, although it's predominantly family caregivers, we also find that sometimes there are friends or other relatives, neighbors, that if that person doesn't have a family caregiver, often it's that friend who's coming in to provide assistance, or professionals, other professionals as well. So this is an interesting slide because I think what it demonstrates is that caregivers are found at every point across the care continuum. So in this example, we're looking at a frail senior and a family caregiver. And so what we find, for example, is that the caregivers, they're the linchpin. They provide transportation, they administer the meds, they often book appointments, they do follow-ups, they provide emotional support, they do the advocacy work. And so this shows, you know, where little stars are, that's often where family caregivers are providing support. So for example, if an aging parent is given a diagnosis of either dementia, or if they've had a chronic, you know, condition, and there's a treatment plan, and the family caregiver is part of that process. They often will help with medication management. They'll make sure if there's any additional equipment that's, you know, required at home. They're going to book up the follow appointments. They're often going to do some type of monitoring around how the treatment's working, and they typically attend the follow appointments. Of course, this is always, you know, the information we're presenting is always in the hopes that the care recipient is, of course, giving consent to the family caregiver to be part of this process. And then with the actual family physicians, again, there could be something where it is a stable situation. They have care in place, and the family caregiver is providing this monitoring, or they're making sure that, you know, medication management, they're making sure that individual can stay independent in their home with whatever supports they require. Acute care is often one of the areas that's most challenging for both healthcare professionals and family caregivers, especially if an aging parent or another, you know, with a mental health challenge where there's an acute episode, they're in the ER. It might take a little while before that family caregiver is notified if they've been out of province, or if the other individual is reluctant and they get discharged without. That's often can be a challenging area. But if it happens acute care, they get admitted and then there's a discharge. That's where the family caregiver is really involved in that discharge process, and really important that they're involved at that critical piece, because there's often changes in medications, there's often changes in services, and they have to help coordinate that piece or be available to take calls from, you know, home community care, or mental health, or the geriatric specialty services. So you can actually see that family caregivers are really critical in the whole care continuum. Is there anything you want to add to that slide?
No, just when you just mentioned specialized services, it's another key role that family caregivers provide is when a loved one, has to go to a specialist, and then, making that information, translating that information between specialists and GPs and reconciling meds, it takes on another dimension when there's specialists involved. And so the word linchpin becomes really important, because that caregiver is often ahead of the information transfer between all these different points and can be that point of continuity. So the role just can't be overemphasized. It's just a very, very important role. And you knowing that as a professional is really valuable.
Yeah, and I suppose if there was kind of sort of two broad themes or two broad areas that you'd be looking at, it would be whenever there was a decision that needs to be made about the care recipient's either, diagnosis, treatment, care plan, that's where it is really important to include the family caregiver. They can often provide relevant information, but it's also important that they receive that relevant information, because they're the one that's typically implementing a large portion of it. And again, I always say this idea that when we're looking at a roadmap for care planning, or that the family caregivers be included in that roadmap and in that plan, so that, again, both ways, so that it can be a realistic roadmap or care plan. Because if the care recipient isn't able to implement it themselves, they're going to need support to be able to do that, and it's with the help of a family caregiver. And also the family caregiver can provide support whether or not that's going to work, realistically, given the care recipient's capacity or their values and belief system, how that's going to fit within that point.
Mm-hmm.
So when to refer? Well, we're big believers every time, anytime is a good time to offer information referral to family caregivers. I think the important piece is too is that most family caregivers, they don't know what they don't know. And so a referral doesn't mean that they have to uptake service. But what it does is it creates this ability for us to follow up with someone. So we may call them and they may say, I'm actually doing quite well right now. I'm going to listen to a webinar, and then we may follow up with them in a couple of months, or they may reach back into our organization. But unless there is that referral, or unless there's that connection, it's a lot harder for that relationship to start. What's really important, though, is if the caregiver, the person the caregiver is caring for has complex or multiple chronic conditions, is frail and elderly, if they have some type of life-limiting condition, and if they're being discharged from hospital. We find those are often the most stressful areas of caregiving, and that's where most people require the support. I know we're going to talk a bit about who we're seeing in our door, but through our door. But what we are seeing with our coaching calls and our caregiver support line are caregivers that are dealing with very complex, multiple chronic conditions of the care recipient, often their own. They're sandwich generation, they have more than one parent, they have frail and elderly, or they've got a spouse that has dementia and they're elderly themselves, individuals dealing with really challenging conditions, whether it's cancer, ALS, and then this discharge from hospital, where there's a little more complicated processes or changes in the care plan going forward. So we have a really easy referral process, we like to think, with limited information so that it's not difficult to fill in. You can actually find it online as well. So you can either print off the caregiver referral form and keep them handy in your clinic or when you're out on the road seeing clients. And anyone can refer, a family, a friend, a healthcare professional, simply by getting their consent to have us contact them. And this is a much more active referral process. The tear off with our RX pads, which was the previous, maybe the next slide. Oh, the next slide too, okay. Is a bit more passive, where you hand out a form and say to them, call these people, they'll help you. This is a bit more active. This is where then we're the ones that are responsible to contact them. We have a very good response rate. It typically doesn't take us long to connect with individuals. And so again, it can be downloaded from our website. You can see the website there, and there's a little Find Resources tab, and you'll see referral form. Here's our family caregiver prescription. This has had a really good uptake in medical clinics. A number of family physicians have really indicated to us that this is one of the greatest pads when they are able to identify a family caregiver. They can rip off and say, call these people. And then we hope that at which point that family caregiver will connect with us. And then we can connect them to the right services at the right time. So now I'm going to pass things over to Janet. She's going to talk a bit about our organization and how we support family caregivers.
Great. Thanks, Wendy. So Family Caregivers of BC is a nonprofit organization dedicated 100% to supporting family caregivers. And one key distinction about us is that we are not disease specific. So Wendy just mentioned previously about some of the key diseases: Alzheimer's, cancer, ALS, Parkinson's, multiple sclerosis. We do not distinguish by disease. We treat caregiving as a generic role. And what we find in our work is that we are a really good partner with all of those disease-specific organizations. So what we provide for caregivers is not specific advice and information about the disease trajectory, but more about, how are you going to manage this as a caregiver in your role, what's common across the spectrum of caregiving, regardless of the disease, across the continuum of care, as Wendy has mentioned. And so I'm going to be talking a bit more about the services that we do provide. So just so that you know that we're, not specific to any one disease. We've been in British Columbia for 30 years this July, which is pretty darn exciting. And we are one of 3 provincial organizations across Canada. So we were the first of our kind as a provincial organization. The other 2 organizations are in Alberta and Nova Scotia. So really, it's a real benefit for caregivers in British Columbia that they have an organization that is funded by the Ministry of Health to provide provincial support. Our mission is to improve the quality of life for family and friend caregivers through information, support, and education. We also provide leadership to strengthen the voice of family caregivers in terms of the significance of their roles. So an example would be this webinar today and all of the work that we're doing with the health sector to collaborate and engage caregivers. Our vision is that family caregivers are recognized, valued, and supported as partners in care. We do our work through three primary pillars. The middle one is caregiver support, and we also do caregiver education, and then, as I just mentioned, health system collaboration. So I'm going to talk a bit about caregiver support right now. One of the key things that we do Monday through Friday, 8:30 through 4, is we run a caregiver support line in British Columbia. And all of the services that we provide for caregivers are free. So it's a huge benefit for caregivers in British Columbia to be aware of our services that we've been talking about already. If they just find out about us, there is so much we can do to help them. If they call our caregiver support line, we offer one-to-one emotional support. We have time to listen to them. That is something that we know healthcare providers are so short on. Is time to just listen, get a sense of what's going on for that caregiver, and from there we can help them in all kinds of different ways. We can help them navigate the healthcare system. We can help them with referrals to community resources. So we are provincial. We do our best to direct caregivers back into their communities through organizations in their communities. We can provide them with access to support groups. We'll be talking a bit more about that. We also have a quarterly newsletter with really great articles of interest to caregivers. We have all these articles on our website. So we are a huge resource for caregivers across the province. Just to give you some idea of the increasing awareness about caregiving and our role in supporting caregivers, we experienced a 36% increase in caregiver calls to our support line last fiscal year, a 216% increase in our coaching calls. So we offer a service where if a caregiver is really experiencing some complex situations, we refer them to one of our caregiver coaches. And Wendy is actually one of our coaches. And she's a gerontologist and has expertise in helping caregivers navigate really, really challenging situations, often involving multiple transitions in care or situations that they're encountering with their own health in addition to caregiving. So it's a really important service that we provide for caregivers. Again, totally free. And this is a great stat. We experienced a huge increase in referrals from healthcare providers. So through this webinar today and just repeating this message wherever we can, we're hoping that you will understand that we're here to help you. So who calls our caregiver support line? Well, at this point, what these graphs show us is that the typical caller is a female, roughly 80 to 85%. But what we know, and this is one of our challenges, that roughly 47% of caregivers are men. So we're working hard to try and increase our reach to male caregivers because we know that they're out there. They're just a little less willing to put up their hand for support. So we're really doing our best. We have a male support group in Victoria that we're working through, trying to establish that support group and increase attendance so we can spread that model across the province. Typical age range of our caregivers is between 51 and 70. So the bottom left-hand graph shows that, the age range of 51 to 60 is the highest age range, and then we get into the 61 to 70. And when you look at who these people are providing care to, it lines up because roughly 57% of the care recipients are parents and guardians, and then 25% are spouses and partners. But we are seeing an increase in the number of caregivers that are caring for friends and neighbors, as Wendy mentioned. With more and more single households, it's becoming a more and more important part of our caregiving segments. is those people who are looking after friends and neighbors, as well, caregivers looking after siblings and other relatives. So it's just a growing role in our whole economy and health system. In terms of employment status, we're still, for the people who are reaching out to us, and probably partly because 30% of them are 61 to 70, we're saying that, the majority are not employed. But what we're expecting to see in the next round of our general social survey is an increase in the number of employed caregivers. That just makes sense in terms of our population in Canada aging, particularly in BC with the growth of the baby boomer segment. Some interesting stats on our call line. So when we look at why caregivers are calling us, so they're calling us a lot about information resources. They're calling us about navigation. They're out there. They don't understand the system. They don't know where to turn next in their situation. And then definitely about emotional support. I mean, almost all of our calls are, to some extent, just as I mentioned, being an ear on the other end of the line, being able to understand their situation, ask some really pointed questions about how we might be able to help them. One of the most interesting things that we have found is that the majority of the people calling our line, our caregiver support line, they're not connected to formal health care in the community. And we have all kinds of sort of explanations for that we've come up with. But when you think about it, when you think about that caregiver who's had someone who had an episode in that previous slide that we showed where they can have touch points with the healthcare system, very often they've been in the community for a number of years and they've been doing okay. They've been coping okay. But again, coming back to that 4-year burnout point, all of a sudden, what's happening with their care recipient escalates. The situation that they're in, they find they don't know what to do next. So that's when they call us. They're reaching out. They're saying, I'm kind of lost. It's been a long time since I've had a case manager involved. I need to reconnect with the system. So that's what we can do. And when you look at the outcome of our support line interactions, the most frequent one is just, how do we direct you to information and resources that can help you? That's roughly 48% of the calls. And then we're providing navigation and assistance. We're doing support, directing people to support groups in their communities, providing that emotional support. For those of you across the province, we do have a strong following on Vancouver Island because that's where we started. But we're really encouraged by the pickup that we're seeing throughout the rest of the province, particularly Fraser Health and Vancouver Coastal. This is a slide about our caregiver support groups. So we will help community organizations start a support group in anywhere in the province, and we've done that recently in Prince George and Smithers. Again, our reach through the Vancouver Coastal Health Authority and Fraser Health is really growing. We just did a training session in Vancouver this past weekend. So we're constantly in touch with different communities and organizations to help them identify if they don't have a caregiver support group, a generic caregiver support group. We're here to help them. We will run a facilitator training session. So we run a training session, we get caregiver support groups up and running. We'll support them once they're running. We also have a community of learning or a community of practice, if that's a more familiar term. That community of practice has roughly 45 members right now. So it's a key area, and we actually run caregiver support groups on the island here. So we have an operating arm right here in Victoria where we try different things. I mentioned the male support group. We're trying different things to try and reach different segments of the caregiving population. I won't go through all of our testimonials, but just to give you a sense of you know, what people say to us. I think the most common thing we hear is, oh my gosh, I wish I found out about you sooner.
Mm-hmm.
And again, so that's our request for you. Just please refer caregivers to us when you come across them, so that they can benefit from the support that we have to offer. We also, under our education pillar, we run webinars. And we record all of our webinars so that after the webinar is over, caregivers can come and watch them again. We refer caregivers to our webinars all the time when they call our support line. Our webinars are often used in our support groups. So they're multi-purpose way of reaching caregivers. What we do is we invite guests to be part of our webinars. And so we've got all kinds of topics, from really practical topics about how to get care across the care continuum, about caregiver processes. We've got brief action planning, decision-making tools, financial facts and tips, and then information that will help them. A big part of our call is focused on the actual caregiver and what we can do to support the caregivers. So we've got, you know, webinars on self-compassion, mindfulness, injury prevention. You know, we've seen a huge spike in the number of views of our webinars from the website. 85% ranked their experiences excellent to good. And one of the key things we're always looking for is, what is the outcome of these webinars? And for us, the key to success is for a webinar attendee to say that they'd actually feel more confident in caring for the person they're caring for. And this is just an example of one of the print screens from one of our webinars. So we make them, they're very interactive. We have a chat screen that goes crazy all during the webinar. So it's a really great way for us to connect. I won't go into much detail. Some very similar demographics about the people who view our webinars. You know, again, it's the looking after a parent, and then the next one is a spouse or partner, mainly women at this point, taking advantage of our webinars. And, you know, still the majority are not employed. Some testimonials about our webinars, and, you know, you can see for yourself when you go online and have a look.
So I think before, one thing I was just going to say is, I think one thing this really demonstrates, we talk about this multi-intervention for family caregivers. And when you look at the services and programs that we provide,
right.
It really helps. We really work hard at customizing the approach on how to support family caregivers based on what they need, where their care recipients at, values and beliefs. And I think that's really what, you know, helps make our program extremely strong, is that there are many prongs to it. And it's not just a one size.
Absolutely. So I think
healthcare sector engagement.
Yeah. Are you going to do this part?
No, you are.
Okay. Jump in. All right. So, so we like to talk about the triad of care, and you know, you as a healthcare provider, you've been you know, more familiar with the dyad of care, the patient and the healthcare provider, but the Change Foundation in Ontario came up with this graphic, and we really like it because we really believe that the patient and family caregiver are separate and distinct along with the healthcare provider. So what matters most to caregivers? Well, we did a survey in 2016, and this was a really interesting result. Has a healthcare provider ever asked you what you needed in order to care for your relative or friend? And, you know, the 72% said no. And then, has a healthcare provider ever asked you what you needed to ensure your own well-being? And again, the majority is no. So again, through this webinar, we are hoping that now you will be able to feel comfortable asking caregivers if they need anything in order to care for their recipient, and refer them to us for support, because that is what we're here for, and it's free. So this is just a slide to say, I wish they knew it's okay to ask me how I'm doing. So one of our biggest goals, and we are aligning ourselves wherever we can with work that's underway with the Ministry of Health through patient care networks and all of the other work across the province, is to get the family caregiver separately embedded into support processes. So we'll know that we've succeeded when people don't have to watch this webinar anymore, because in fact, the family caregiver is part of your process as a care provider. So just as in the United Kingdom, where it's now part of what they are obligated to do under the Healthcare Act, family caregivers will be part of every process without even thinking about it. The family caregiver will be acknowledged. There will be a plan developed for the family caregiver. They will be referred to us for support. That's why we're here. So it's really not a big extra piece for healthcare providers to tackle. Here's some examples of caregiver-friendly healthcare. So when we talk about accelerating family-centered care, you know, writing and saying the family and patient and family care wherever we can. We talked about the private primary care networks, so including family caregivers. We are involved in committees. We have family caregivers reps involved in that work. Wendy talked about the clinical moral distress. We really hope that the referral pad and our online referral form helps you with that. So when you see a family caregiver, you're no longer going to be thinking, oh my gosh, I don't know what to do with them. It's obvious. You send them to us. We'll make sure they get where they need to go. And, you know, through our webinars, through our caregiver support line, enhancing the knowledge and skills of professionals and family caregivers about how to engage with each other. There's some evidence that we're making progress, so we wanted to kind of make sure that you knew. In 2016, the Docs of BC did a policy paper with a toolkit for physicians about family caregivers. So, you know, raising that awareness and helping them understand how they can recognize and support family caregivers in their practice. We're starting to see caregiver support in guidelines, which is really, really encouraging. So this is one example of the resource guide for older adults and caregivers that's online through BC, the province of BC. New frailty guidelines, again, here we are, family caregivers. So this is what we're talking about when we're mentioning embedded in processes. So it's no longer, you know, up to someone to think, oh yeah, the family caregiver, because there it is right there. You don't have to think about it. And we're really thrilled that work is underway right now to develop a person and family-centered care policy and toolkit. It's in draft form, and we're very hopeful that that's going to be you know, approved and come out very soon. And so we will be there to support the implementation of this policy and toolkit. That's why we're here. It's also going to tie right into the specialized community services program for adults with complex medical conditions and frailty. Yeah, another key piece of work that's underway nationally, and we are involved in this work, is the Canadian Institute of Health Information is in the process of developing a caregiver burnout indicator. So the acknowledgement nationally that this is a very important piece and also needs to be addressed at a national level. It's very exciting that we're being included in that work and involved in the expert advisory group that's informing that work. So I think with that, we have finished the formal part of our webinar today, and would just like you to know that it's really easy for you to reach either of us. So myself, Janet McLean, or Wendy. These are our email addresses. And we hope that you will connect with us. We're here to listen to, you know, if you have any suggestions or thoughts that you would like to share with us, that's why we're here. And just really like to thank you. Thank you very much for joining us today.